Hello nurses, welcome to another session of Nurse Talk. Now we are going to discuss about the types of respiration. There are different types of respiration. First one we are going to see is eupnea. Eupnea is a normal respiration. It is a normal respiration. Our normal respiratory rate is 12 to 20 breaths per minute, and it can be depicted in a graphic representation like this. This is eupnea. Next one is bradypnea. We all know the term brady means less or slow. So bradypnea is a slow respiration or less than 10 breaths per minute. This can be depicted in a graphical representation like this. This is bradypnea. Tachypnea is a faster respiration of more than 24 breaths per minute, and it is a shallow respiration. You can say it is a shallow respiration, and this is tachypnea. Next, on one of the most important type of respiration is KUSSMAUL's respiration. KUSSMAUL's respiration is a respiration that are regular. They are regular respiration, but normally deep and increased in rate. It is a deep respiration with increased rate. That is KUSSMAUL respiration. It is a labored breathing. Sometimes KUSSMAUL respiration is also known as labored breathing because the patient is taking so much of effort in having or taking a breath. That is seen in KUSSMAUL respiration, all often associated with severe metabolic diseases like diabetic ketoacidosis. Remember, in case of diabetic ketoacidosis, it is a metabolic disorder. The patient can show KUSSMAUL's respiration. It is a labored breathing where the respiration is regular but abnormally deep and increased in rate. KUSSMAUL's respiration is a very important topic for all the MCQ examinations. It is a regular but abnormal deep breathing often seen in metabolic disorders like diabetic ketoacidosis. Can also be said as labored breathing. Next type of respiration is BIOT'S respiration. BIOT'S respiration is a quick, shallow inspiration followed by regular or irregular apnea. Apnea means absence of respiration. So in this type, there can be regular or irregular. It can be of variable depth and followed by apnea. Okay, so there will be variable depth respiration first, and then apnea will be there. Again, variable levels of respiration, apnea, variable levels of respiration. Most important thing is it can be regular or irregular. Most of the times it is irregular breathing pattern. BIOT'S respiration is oftenly seen in disease conditions related to medulla oblongata. Medulla oblongata. If the patient has got any damage to medulla oblongata, the patient can experience BIOT respiration. It's a irregular respiration of variable depth. It is varies all the time. It varies, and followed by an episode of apnea or absence of breathing. The next one is chain stroke respiration. Chain stroke respiration is a gradual increase in depth of respiration followed by gradual decrease and then period of apnea. That is the difference between BIOT'S and chain stroke. In chain stroke, what happens here is a gradual alternating period of deep, gradual and apnea. Again a gradual apnea, gradual increase of breathing and then apnea. This is chain stroke. In chain stroke respiration, alternating period of deep and shallow breathing and then followed by apnea. Deep and shallow breathing followed by apnea. Most commonly seen in disease condition of heart failure or increased ICP. Remember, chain stroke respiration is commonly seen in heart failure or increased ICP, whereas KUSSMAUL respiration is seen in diabetic ketoacidosis or metabolic disease conditions like diabetic ketoacidosis. KUSSMAUL respiration is also known as labored breathing. Okay. And what will be the most important difference between BIOT'S respiration and chain stroke respiration? BIOT'S respiration is an irregular pattern of breathing followed by apnea. Irregular pattern of breathing followed by apnea. Whereas chain stroke respiration is a gradual increase and decrease. Gradual increase and decrease followed by apnea. Gradual increase and decrease followed by apnea. Remember, chain stroke respiration looks like a thorn. Then apnea, thorn, apnea. Okay, so that is the difference between chain stroke and BIOT'S respiration. Chain stroke respiration most commonly seen in disease conditions of increased ICP or heart failure, whereas BIOT respiration is seen in a disease condition related to or damage related to medulla oblongata. Okay, and Kussmaul's respiration most commonly seen in diabetic ketoacidosis. Kussmaul respiration is also known as labored breathing because the patient is taking so much of strain to take the breath. That is why it is known as a labored breathing. And the last type of breathing is apnea. Apnea means absence of breathing, and the graph will be shown in a straight line for apnea. When we're talking about this, I just want to let you know about some more terminologies related to the types of respiration. First one is platypnea. Platypnea. Platypnea means patient has dyspnea or difficulty in breathing while sitting up. If the patient is sitting up straight, the patient has difficulty in breathing. But when the patient lie down, the breathing that will ease the breathing. So difficulty in breathing while sitting down, sitting up. So if a patient sit up straight and the patient has a difficulty in breathing, that is called a platypnea, and this type of breathing difficulty will be relieved when the patient lie down. Okay, so that is platypnea. Next one is orthopnea. Orthopnea. Orthopnea means a disease condition where the patient has difficulty in breathing while lying down. So when a patient is lying down, the patient has difficulty in breathing, and that difficulty will be relieved when he sit up straight. That is called orthopnea. Remember, orthopnea is a disease condition where the patient has difficulty in breathing while lying down. When the patient sleeps or lie down, the patient might not be able to take proper breath. This is called orthopnea, and orthopnea is seen in asthma. Okay, if you have seen an asthma patient who is lying down and having a struggle of taking breath, that is orthopnea. The patient has got orthopnea in that condition. Okay, so that is orthopnea and platypnea. Platypnea or difficulty in breathing while sitting up straight is seen in hepatopulmonary syndrome. Okay, platypnea is seen in hepatopulmonary syndrome where the patient will have difficulty in breathing while sitting up straight, but the patient will relieve the breathing issues while he is lying down. So that is the difference between platypnea and orthopnea. Very, very important 2 points to remember. And there is another type of breathing difficulty called trepopnea. Trepopnea means dyspnea sensed while lying on one side. If the patient is lying on one particular side, lying on one side. If the patient has difficulty in breathing on lying on one side, that is called treptopia. But this pain will be relieved if the patient change the position or move to the next side. Move to next side will relieve the difficulty in breathing. So that is the 3 types of breathing difficulty that can be seen. And treptopnea is seen in the disease condition of major bronchi. If the patient has a disease condition on the bronchi of the lungs, the patient will have trepopnea. Okay, so this is 3 types of breathing difficulty can be orthopnea and platypnea and trepopnea. Platypnea means the patient has difficulty in breathing while sitting up. Orthopnea means the patient has difficulty in breathing while lying down. Orthopnea is most of the cases. Orthopnea is seen in asthma patients. And then trepopnea, where the patient has difficulty in breathing while lying down on one side, but he will relieve the breathing difficulty when he changes the position or move to the other side of the body. Other than that, we studied in this session about the types of respiration. Most important things are KUSSMAUL respiration, BIOT'S respiration, and chain stroke respiration. KUSSMAUL respiration is seen in diabetic ketoacidosis. BIOT'S respiration is seen in the patient has got any damage in the medulla oblongata of the brain, and chain stroke respiration is seen if the patient has got an increased ICP or heart failure. Thank you very much for watching the video. See you with another session. Bye-bye.